I welcome all of you to IBM TV and to this show, which is Dr. Dhawan's live chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The live chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste. Namaste. Good morning, good afternoon, good evening, depending on wherever you are. Welcome again to yet another session of Dr. Dhawan's live chat on IBM TV on this Friday evening. Last week, we talked about COVID, the second wave, the deadly second wave, and how to deal with that. Today, we will be talking about another important aspect of COVID in children. Because unlike the first wave, the second wave is affecting young adults and children alike. And I have got two very important guests with me to talk about this subject. First of all, Dr. Nitin Verma, who is the Associate Director and Senior Consultant in Pediatrics at the Madhukar Rainbow Children's Hospital, New Delhi. He's a very senior and very accomplished pediatrician. I'd like to welcome Dr. Nitin Verma on the show.
Good evening. Namaskar.
Good evening. Namaskar. Thank you very much for taking time out to join us. I know this is your sleeping time and you'll be delaying your sleep for us, but thank you very much. And it'll be like you'll really, the audience will really benefit from your knowledge. The next guest I have is Dr. Manpreet Khemka, who is a senior child psychiatrist working in Hattiesburg, USA. She will be talking to us about the mental health issues in kids due to this pandemic, COVID, and how the COVID affects them and their families. So welcome, Dr. Manpreet, on this show.
Hello, everyone.
Hi, Dr. Manpreet. How are you doing?
I'm good. Thank you for having me here.
Pleasure. So let me start with Dr. Verma. Of course, this last 1 year has been really bad for all of us, and so much of pain and suffering. And when we thought that it is kind of settling down and going away, it has suddenly come back and hit us really very, very hard as the what I call deadly second wave. In the first wave, somehow the children were not affected so much. Young adults were not affected and spared. So is that true, or is it just belief that kids were not affected in the first wave?
So let's look at it from different perspectives. Were children affected in the first wave? Yes. But they impacted in the first wave? No. So we did have sporadic cases where the parents tested positive. We never had to do anything beyond putting the baby or the child, on a multivitamin with zinc, some vitamin C. Most of them would have no symptoms. Very few would test positive. But suddenly everything has changed, and it's changed in a dramatic manner. Let me try and explain it in a different perspective. Let's say today, if there is a family of 4, a nuclear family, mother, father, and 2 children, and if one gets COVID, both the children will get COVID. So it's impacting children in a huge way. From a time where in the first wave, I could, maybe treat 1 or 2, we've reached a stage where I have 10, 15, 20, 30, and there have been days when more than 40 people wanted to discuss fresh COVID cases. And this is only the tip of the iceberg, because that people stay in denial, mild cases are not tested. And as we are seeing that there are a lot of asymptomatic young people who don't have symptoms. And how do you get to know? You have to travel, so you need to test. You test, you find you're positive, but you've been spreading it. The problem is not just the asymptomatic people. The problem is that this time children are being symptomatic. Fortunately, as we'll probably discuss later in the show, the symptoms are mild in the younger children, but we've seen the whole gamut of cases this time, from febrile children having mild illness to having different manifestations. So it's no longer just cold, cough, and fever with which the child is presenting. They're presenting with diarrhea. They're presenting with gastrointestinal symptoms. They're presenting with rash. So the manifestations are manifold. As I said, in many, it's the manifestations are mild, especially in smaller children. Though we've had to admit children who were small as well, but the percentage is small. But as the child becomes bigger and goes into adolescence, they tend to have more severe symptoms.
So, sir, what
So,
has changed in the last 1 year between the maybe the previous strain and this strain? What has really changed? Kids are the same, their immunity is the same. So, what has exactly changed now?
so maybe the virulence or the number of people that it impacts is much higher. Children are vulnerable, and also what has happened is that we've suddenly got used in the last 1 year to children not falling ill because they don't go to school. So illness comes when you gather and you meet other people. So the we've been used to children not falling ill, and because we always thought that COVID is a mild disease, we've been caught on the back foot. We perhaps were not prepared, and as I said, it's only the fact that we do not require as many hospitalizations or as many children requiring repeated blood tests, not as many children who require CT scans. We'll discuss that probably later in the
Right.
show.
Right.
Is still keeping our nose above the water. But
So,
yeah,
yeah.
go ahead.
So what are the clinical manifestations, signs, symptoms with the kids present, and how is it different from the adults? You said, of course,
So,
diarrhea, rash, and all, but other things.
so honestly, when I talk to my younger colleagues in the hospital, and I tell them that any child who's unwell, whether it is a cold, a cough, a fever, conjunctivitis, brilliant, isn't it? Sanjay's topic. So back to you. So they are
Yeah.
just presenting with a red eye and gastrointestinal symptoms, obviously. So we it has to be a high degree of suspicion. Then you need to test, and you also need to time the test right. Because if you test it too early, you're not going to get a positivity. And when you test at the time when the child is febrile or is in the peak of symptoms, because that's the time when the virus is being shed maximum, that's the time that you have peak positive rates. Again, we've struggled over the type of tests which are there. So the gold standard being the RT-PCR. Uh, that too has a positivity rate of only 65%. Sometimes it's not easily available. There are long queues for people who want to get the test done. So you miss the bus of when to do it. Sometimes you also have to do it more than once. The family, what happens? I'll give you a simple example. Mother, father have fever. They are scared. They have a 2-year-old in the house. Test the child, but the child is not infected or symptomatic as yet. And thereafter, they're in thinking that oh, my child's fine. His test is negative, not realizing that a positive test is positive, but a negative test, it can still turn positive.
Positive.
So the timing of the test is it's important. And if you time the test right and get it done from an accredited lab, and there are a lot of labs now which are doing it. There's a huge amount of pressure, but you do it from a NABL accredited lab, then by and large we get correct reports. So symptoms, as I said, could be anything. So fever normally lasts in small children 1 to 2 days. They could be rhinorrhea, cold cough. There could be loss of appetite, vomiting, loose motions is not uncommon. In fact, we're seeing it in almost 15 to 20% of cases. Rash has become very, very common. And of late, the first thing that you may get is that the child has got a red eye, and that may be the primary symptom of impending COVID which is going to come. So that's the symptom that you need to look out. You need to have a high index of suspicion, and once you suspect, you may test. So sometimes, since you don't want to test a child, it may be worthwhile to test the adult in the family. If he's positive and the child has symptoms, then indirectly you know that the child is positive as well. Why is it important to test? It's important to test for multiple reasons. A, obviously, you need to have an accurate diagnosis as to whether or not the child has got COVID. Two, you then need to isolate contacts. How are you going to stop the spread? So if you isolate these people and if you're managing in a home quarantine, then we prevent the spread to other people. Third, it is important because often a child cannot be left alone. You may have a 16-year-old child who's alone in a room, and as long as he has Netflix, he's fine. But you can't isolate a 2-year-old child. The mother needs to be there. So I need to advise as to what precautions to take, how much distancing to do. What if the baby is 6 months old and the mother is feeding? Or what if the mother tests positive and she has a 6-month baby? Who's going to be the care provider? How are you going to feed? What precautions are you going to take? So the gambit is endless as compared to an adult where it's simple. You've got COVID, fair enough. You know what needs to be done. You talk to your physician. It's you and the physician. But here in pediatrics, there are 3 dimensions. It's the doctor, the patient, and the parent. And that's what makes the management difficult.
How is the clinical course of the disease in kids? Is it a milder disease or can it be severe also?
So
do parents need to be really alert about any severe things?
So yes, so we need to know that the first thing I think that we need to acknowledge is that we're still learning about this virus, and I don't think there is any shame in doing it, because we get different things and we find new things. So we realize that post-COVID there is a syndrome of multi-system inflammatory disease in children. We've also we realized it over a period of time when a child would come and you had unexplained fever suggestive of a Kawasaki or a multi-system. And when we kept thinking, and then when you check for the antibodies, the diagnosis was clear. But coming back to what you said, fortunately, a majority of the children are having a mild course. So if I were to try and divide it into 3 groups, below 5, 5 to 10, and more than 10, fortunately the symptoms in below 5 are mild. I've had an opportunity to treat a very large number of children, including babies 2 months, 3 months who were COVID positive. All had a reasonably calm course because we were able to diagnose, we were able to look and educate the parents about the complications. So you have to see, you're not admitting a child. An adult can tell you that I am unwell, but unless I alert the mother or the father as to what the symptoms are in a 2-month baby who doesn't speak, an important sign may often be missed. So you have to take recourse to explaining to them. Very easy to measure the oxygen saturation for an adult, right? Have you tried measuring the oxygen saturation for a 2-month baby where the probe is the adult probe? It's terrible. And you do it, the heart rate is 160, there's panic at 2 o'clock at night. So you need to educate them what you need to do. The second part is to educate them about what are the complications. And please understand that all these are being managed remotely. I'm not seeing the child, or the pediatrician is not seeing the child. We're doing virtual consults, and it's only the sick people who then come into the flu clinic in the hospital and are then examined by a certain set of doctors who then are examining only COVID patients, and they go into a floor which is reserved for COVID people. There's also a scare. Should I go to the hospital? That's a COVID hospital. My child is all right. He doesn't have COVID. Can I get COVID from there? So you need to understand and explain to them that the common complication that we look for are, the clotting and the respiratory and the inflammatory complications which are there. So we do a set of tests which we normally do around the fifth day, and these include a CBC, a CRP, a ferritin, a D-dimer, IL-6, and the LDH, which gives us a clue as to how the disease is progressing. Most children below 5 are managed conservatively in case they have fever. And mind you, a lot of our treatment is not substantiated. We may offer once a day antibiotic to prevent a secondary infection. We know that antibiotics have no role in COVID, and the antibiotic of choice is azithromycin macrolide. Most children at this age have fever lasting for 2 to 3 days and then tend to settle down. They continue to have a little bit of rhinorrhea, and you look at their well-being by the fact that the child is active, is feeding well, his respiratory rate is fine, his intake and output is fine, and he seems cheerful when you examine them on a video consult. Children from 5 to 10 have moderate symptoms. In some of them, the fever tends to persist for a larger period of time. And these are children that we sometimes evaluate a little bit more. Children over 10, between 10 to 18, I see up to 18. So are of two types. One which will respond very quickly once you start treatment early, and some who will persist to have fever. And mind you, here is a fever which is going into day 5, day 6, day 7, day 8, day 9, day 10. You do a CT scan, and you really know that a CT scan is going to give the radiation of almost 400 X-rays. So you need to be judicious. And then we have a scoring on the CT scan. And it's not just doing the CT scan, it's the progression which helps us to decide whether we need to up the antibiotic, or we need to add steroids, or we need to give inhaled steroids in the treatment. It's also important to note that there must be a timing of when you do it. Don't be ready to give a steroid before day 5, day 6, because if you give a steroid at that time, it may help in viral replication and may actually make the disease worse. So it's only if the oxygen saturation is not being maintained, or the fever is not coming under control, or if there are findings in the CT, then we would tend to add steroid. So some of these children, maybe about 3 to 4%, progress further, do not come under control with oral medications, and may require hospitalization and management for a period of time. Even in hospital, in most of the cases, treatment has been symptomatic, but there it's possible to monitor the oxygen saturation. Not comfortable with if you have a hospital bed, with giving oxygen in the house. At some time the mother will sleep. What if the oxygen dips? We don't want any problems with that. So once they come, it's again standardized protocol. It's symptomatic. Unlike in adults, we don't rush to using antivirals like remdesivir. Is used in very few cases. We really don't believe in using favipiravir, but yes, in bigger children, we do use ivermectin, dose of 0.2 milligram per kg, 2 hours after dinner for 3 days. This is one of the few antivirals which tends to help in children. So as I said, majorly mild to moderate, very small percentage, 1 to 2%, having severe symptoms, who require more aggressive and inpatient treatment.
You mentioned about thrombotic complications also. Are they quite common in kids as well?
No, not really. I mean, maybe out of say 500 to 1,000, I had to put one child on, and again, you're looking at, and sometimes you have problems, in certain labs when you're looking at a D-dimer to guide you. So remember, this is a kit which gets imported, right? And from a time where I probably asked for 3D dimers in a year to my asking for 25D dimers in one day. And I'm just one doctor. So you can see how much pressure has come. So sometimes you have problems where you're not sure. Again, when you look at the levels, one shouldn't panic that the level is up to zero point 0.5, it's zero point 0.6, so you need to start. So there are cutoffs. So between mild, moderate, and severe, and it's only in the severe cases that we need to use drugs, not in mild cases.
What is the mortality rate in kids and young adults?
Very, very difficult to say, because unfortunately we don't have the best of surveillance system. But in our hospital, which is a tertiary care standalone pediatric hospital with almost 100 dedicated pediatric beds, we haven't lost a child as yet, right? That doesn't mean that there have been no deaths. There have been deaths. And I think the mortality also tends to see, we are in a metropolitan city, where people are more educated. So they'll come early to a doctor. It's a question of how soon you pick up and how soon you start treatment. You have somebody who comes in collapsed and moribund, then even in the best of centers, it'll be, we fortunately, because of the fact that everything is COVID, right? So that's all that you see morning, evening, and night. So everybody is tuned to thinking of COVID. And we are probably picking it up early. Children are also very, very precious. So you may have an adult who ignores himself or his wife and say, it's okay, it's mild, I'm not going to test. But he's not going to take that chance with the child. So, children being precious, they do reach. So far, I think the mortality rate is less. The problem is also separate in children. And there are two factors that we need to consider. The first factor is that there is no vaccination for children, right? We do know that in some countries, they're going to start with the Pfizer vaccine for smaller children as well. But so far, the vaccines that we have in India, which is the Covaxin, Covishield, and now the Sputnik, which has come, have only been tested in age up to 18. That means the children are unvaccinated. So that's the first reason. The second thing is that schools haven't opened. So as yet, you're only picking it up from when you go out, or you pick it up from your parents or your grandparents. Once schools open, there's going to be mayhem, which is there. And more people, so we know that because of different strains that come, the vaccine may not be 100% effective. But I think there is conclusive data to show that people who've taken the vaccine are more likely to have milder disease and may not end up in an ICU. Not to say that they won't, but at least there is some protection. Because when you look at the antibodies and you're looking at the spike proteins, that may be against a strain which is not covered, and every day there's a new strain which comes, right? So over a period of time, as more and more people get the vaccine, and unfortunately as more and more people get the disease, some kind of immunity will come. And soon I think we're going to be entering a phase where we will probably need a booster dose, and that may help. Because it's the initial dose kind of primes you and gives you good antibodies, and the second dose boosts that up. And as new strains emerge, it's going to be pretty much like the swine flu, where the strain changes every year. So maybe the boosters, and maybe a combination. Maybe instead of using a vector vaccine or a killed vaccine that we have, maybe we'll also have a mRNA vaccine which comes into India, and maybe a combination. As I said, this is only conjecture. Will give us better protection. The unfortunate part is that all that we do is that we look at a blood level and you measure antibodies. And the truth of the matter is that the level of antibodies do not correspond with your protection. So this is also my message to all people who are there, that the time to flaunt your body and antibodies are both gone. So there's no point in saying that, oh, my antibody levels are 120 and I can go out without a mask. No, you can't, because you're going to get it and you're going to impact. And the way that we are seeing that children are getting more impacted, this is the second wave. There is talk about the third wave. We need to be very, very vigilant. We need to be very, very vigilant, because while we may have X number of beds, these are X number of beds and facilities for adults. You don't have that same facility. Treatment for children is specialized. So we need to be very, very careful.
You hinted at the third wave, thought of third wave, and it is said that probably the third wave will impact kids even more. And the reason being that kids are being looked upon very lightly at the moment. The adults tend to think that kids are safer, so everything is a little easy for the kids. And that may actually lead to a transmission which will impact kids more by a particular strain, which may actually affect more, and the spread will be much faster if the schools open up.
Yes,
is that a fear you also share?
It's something I am mortally scared of. I don't want to, I mean, I have this conversation with parents, and sometimes I get upset with them, and because of my age I get away with it. So the schools opened at that time. Some schools opened, and so there was this parent who wanted to send his 4-year-old child to school, and I actually asked him. I said, can we have a consult when I want to have your parents also said? And I asked him, I said, if I ask you what your education level is, you'll feel offended, but you're not behaving. So certainly you'll turn around and say, no, Dr. Verma, I am from Harvard. I said, but you don't behave like one. What is when we haven't reached a stage where even the caregivers, the teachers, the attendants in the school, even they are not vaccinated? How can you send your child to school? Some boarding schools, elite boarding schools opened, 80 people in a dormitory, all 80 got COVID. So there is a message for us there. We have to learn to live with this disease till such time as there is a foolproof vaccine and a foolproof treatment. Even treatment today is not foolproof.
Right.
So till such time as we have that, and given the dynamics of our country, the population of our country, we're talking only of urban people. Let's talk of the rural people. Look at what penetration that we have in vaccines. Unless we are able to percolate it down, it's good. The epidemic may get over. We may have flattened the curve in Delhi. What's going to happen in a village or in a rural center, where suddenly XYZ sits in his big car and goes there for a holiday and creates a pool of COVID there? How do we manage? So we need to have caution. I think it's time to have doctors and healthcare people advising. That's all that we can do, right? Advising people who matter. So look at the trauma of somebody, and Manpreet will probably deal with that later. Look at the trauma of somebody who loses a parent, a grandparent, a friend. And that too, I can give you a personal example. One of my closest friends died 3 days back of COVID. It didn't matter that he came from the best school or the best college or he was very affluent. He didn't survive the disease. And if we have something which is preventable, then we must take every step. And while you can't do everything and you have to balance life and go on, there are some set of rules which need to be enforced. It doesn't matter. When you drive a car in Dubai, you will not break the speed limit because there's a camera which will pick you up and you'll be behind bars. That fear needs to be in everybody, that you have to confirm, because it's not your life which is at stake. It is other people's life which is at stake. And the truth, and I hope there are non-medical people listening to this. This is actually something that you should know, that maybe in some time you may have beds, you may have oxygens, you may have oxygen concentrators, you may have ventilators, you may not have doctors. Remember that more doctors have died from COVID than people of the Indian Army in the last year. People, nurses, and Sanjay will bear out with me, are leaving and going away. They are not able to do it. Doctors are facing depression. They are not able to face what is happening. So that's another aspect that you need to. It's tough for you to sit for a 14-day quarantine in your house. Can you imagine what happens to a doctor who has to go in, day out, and work there? It's terrible. It's terrible. So at some stage, please be scared, because children's life is at stake now. And as the second phase has shown us that more and more children were impacted, mortality is less. If you compare it with the first phase, God help us in the third phase. So unless we take corrective measures, it doesn't matter what the other person is doing. Let me do what I can do, right? If each one of us decides to do that, then we have a chance. Otherwise, we're in for a long haul and for a bad time.
Yes, the laxity that which we actually acquired in the last few months has given us a very, very hard lesson. But it's the right time to take steps for future and to prevent it from affecting our children. Because if we do not act now, kids are likely to be very badly impacted in the next wave. And sir, you touched upon the mental health issues. So I'd like to bring Manpreet over here. Manpreet, can you tell us that how has the COVID as a pandemic affected kids? Especially the kids are now bound indoors, they cannot go out, all the classes are online. And then they're seeing so much of a disease and depression and death all around them. And some of the kids have lost their family members, some have lost their parents and friends. How does it impact them?
Right. So, this is one condition. I feel like we are not all in the same boat. We are all in the same storm. And how it has impacted children, it has definitely impacted all children. The degree of severity based on the circumstances in the house and what is the real danger that they are facing. So based on that, the manifestation may be different. But I feel that almost all children, regardless of whether I see them in clinic who are having some clinical depression, anxiety, or be it in community where I'm talking to my friends or seeing my own children, I think it's having mental health impact on every child. Because the sense of normal childhood where you can go out and play and be carefree and just enjoy your life. You can go to school, have that experience of engaging with other kids without having that fear that you're going to catch something. So that sense of normalcy has broken in the last 1.5 years or so. So I think it's impacting everyone. The course or just the manifestation is different, more benign. What kids may complain is just that sense of boredom. If they are sitting in the house in front of that virtual school, online school, they may come to you and they may say that, I just don't want to do that. The attention span may not be there. So I have seen kids who used to be all A student and never had any failure in their life so far. But now their grades are declining, B's and C's, and they constantly complain that it's very hard for them to just figure out things by their own. And online teachers are there to support, parents are there to support, but it's not the same thing as being in the classroom and hand-on learning. So the boredom, attention span, then many kids are more irritable than they used to be. The tolerance and fights amongst the siblings or the arguments with the parents and why am I not allowed to go to this place where my friend is going? Because everybody is not handling it. All families are not handling it. Even in US, the leniency and laxity in some families, it's mind-boggling. Like why you are still not getting that sense of you have to stay protected despite being vaccinated. So that's on a more benign level that kids are struggling with. Clinically, I'm seeing patients on the inpatient unit. I work primarily on the inpatient unit. And in the last 1 year, in my experience, there are many kids who have come who had no previous mental health history, but now they are having a full-blown clinical depression, not just sad moods or anxiety or worried about different aspects of life, but also changes in their sleep patterns or their eating patterns, losing weight. Some kids who are with this online schooling and they have not had much outside exposure, not much physical exercise, their weight gain. So, I have seen kids who have gained like 40 pounds, 50 pounds in the last 1 year because of that sedentary lifestyle and that balance not being maintained by the families with the diet control or the screen use or the sleep pattern and the regular exercise. So, again, like I said, we are different boats in the same storm. The impact has been much harsher on children who used to have, even before COVID, who had, say, problems like, say, autism spectrum, or they had history of clinical depression, anxiety, even in good times. So they have had the blunt even more than children. But then I have seen many kids, they have no family history, they have no previous history of mental health disorders, but now they are admitted to the psych unit with frequent suicidal thoughts, that sense of gloom and doom and not seeing a future beyond this. So earlier there was, when this was that uncertain initial phase, there was a lot of anxiety, what to expect. We did not know what to expect. And now going over this over past so many years, so many months, seeing the examples like Italy and Brazil and now India. My daughter, she told me that in their Zoom classes, she is getting these, her friends are checking on her. How are your grandparents doing? How is your family back in India? So I feel it's even those PTSD kind of symptoms, you don't have to be in the middle of the trauma for you to have all these signs of that impending doom happening, nightmares, sleep disruption, and just the conversation being so pulled into how it's going to impact my immediate family or my friend's family. It's been there on kids. It's been there on their minds.
So, what about kids who had the family members affected by COVID, or if they've had a death in the family? How do they respond to this?
Yeah. Again, we can't overgeneralize it. It really depends on the level of functioning of the child, how well adjusted they were previously, how much is the sense of structure, support, and some sense of function and mature adults in the house. So, of course, their prognosis is better compared to a family where parents are dysfunctional, they have their own issues with parenting, or maybe they're having some substance abuse issues. Maybe the parent has lost a job. Some single parent where there is a loss of income and financial instability because of loss of a parent. So children are going through different, the way it's hitting them is very different based on the circumstances. So even grief, I think we cannot generalize how it's impacting them, but it is hitting them. And I have had so many families here where we are trying to work as a whole team, where my role comes more as medication management is needed. But then we are also involving the school counselors or the school teachers, the parents, the uncles, aunts, extended family, to provide that sense of support. Now, anytime a child is going through grief and it is close, it's hitting home, there is always that fear of, am I safe? Is my family safe? Am I going to be the next one? So it has been difficult on children to see that it's not like an alien thing that's happening. It's right on our doorsteps now.
Do you think that the Indian children would behave differently or respond differently than the children in US would do to the situation?
I don't know. It really depends on family, the parents being the first responders there, how parents' maturity level is, how they are helping their child adapt to it. I have seen, examples from my own families where parents are not being good role models. They are going outside, they are attending wedding parties. Then what to expect from children? But I have seen, situations at home where parents are teaching the kids about, they have some civic sense more than just being stuck into what they are missing in life. This is a crucial phase, and how they are adapting to this phase is going to keep them safe, their families safe, also build resilience, also build that sense of flexibility. Situation, life does not come in a platter, and you have to learn how to modify your responses according to that. So I think it doesn't depend on the demographics or where in the world we are, but how just the family environment around us and what message we are getting even from the leadership and who we are choosing to listen to. That's going to impact kids' perspective of how to deal with this.
Verma, can I have your views on this? That what is your observation and your views about how the Indian kids are being affected emotionally, mentally by the whole situation?
So, I tend to agree with Manpreet that, we often look only at physical symptoms and disease. We often tend to forget what is happening in the mind of the child.
Mhm.
And so this is something which we've seen in a lot of children. So defiant behavior, children putting on huge amount of weight. So you had a child, I'm having a video consult with a child. So the software shows that the last child came to me 6 months back. His weight was 39 kgs. I asked, what's the weight? It's 50 kgs. So he's put on 11 kgs. So, so the control which is there, and I think it's extremely important for parents to lead by example. Then the fact that they can't interact with their friends, the fact that they can't have physical contact with their friends, the fact that they have to have prolonged exposure to the screen, so everything is online. And then the problems, the parents are also aware, if they're going to be classes for 5 hours, then they don't have time for other online activity. So everything is taking a hit. The mother doesn't have freedom. The children would go for work, so she had space in the house if she was a housewife, or if she was working she could go. Now she's meant to work in the house and look after the children and do everything, when she's doing the same amount of work that she would do when she was in the office. The fact that there are no recreational activities, the fact that you don't have sports, the fact that you can't go in and swim, the fact that you can't meet with people, have parties, chat with people. So what do? You start doing that in the middle of the night. You start reaching out to your friends. That impacts your sleep. That impacts other things. So I think there is a huge amount. This is something which has been lacking in medicine for a long time. But I think that time has come. So now you know that schools have got counselors. Even Indian schools have got counselors. So you need to look at the child not only with his physical but also the mental well-being. So there has to be a process which is there. And I think maybe if this is going to go on for a period of time, then we need to devise ways and means of how to help the children. And maybe Manpreet will have something to say about that.
Yeah. And you mentioned about the screen time. Actually, the screen time has increased many folds over the last 1 year, not just for adults, but also for the kids, and especially for the kids. And I'm seeing a huge increase in the number of visual strain. So eye strain, eye problems, eye irritation, pain in the eyes, headaches, brow aches have increased many times. The visual problems have increased a lot. Headaches have actually increased a lot. Migraines have been seen more commonly because screen time has increased. And as Dr. Verma, you rightly said that middle of the night, kids are interacting with their friends and all. They're entertaining themselves. So the sleep is disturbed. There's not enough recovery of the eyes and of the body and of the mind. So it affects the whole system and everything. The whole body rhythm is gone totally off the track, and with the excessive screen time is also causing mental health issues. It is seen that inadequate sleep, excessive screen time can even cause depression, irritability, loss of concentration, mood instability. So all this I've actually seen an increase in the past 1 year. And the only way to deal with this is prevention. The sooner the COVID settles down, the sooner we bring it in control, the better it is for the children. And for that, we need to work hard now. What do you think, Dr. Manpreet, will be the future impact on kids' mental health of the situation that is going on here? And then what is your message for the parents and adults that what can they do right now to prevent that from happening?
I think this is a disaster we are going through. This is a big crisis we are going through. But I think, say, 10, 15 years from now, hopefully this will pass off. And I see it as an opportunity. It's building and it's shaping the kids forever. Like we used to talk about 1947 partition and the major 9/11, major things happened and how it has left a big imprint on child's mind. So I think the way it's shaping them, how it's going to leave a mark on them, that's really dependent on factors going on in the house and how well supported kids are. So I talk to my children and I talk to my patients and I try to give them a little bit hopeful, bright side of it. That we are in the middle of pandemic, but we are in that era, that generation that we are socially distant, but we are still connected. So it's kind of putting in perspective, like really, end of the day, what is it that's important? So, yeah, and like you said, the preventive aspect of it. Yeah. So even before the pandemic started, the screens have been seeping in. Kids have been compromised on lifestyle and physical exercise. The sleep was compromised. Now, when we talk about the preventive aspects, we have to stress on the role of nutrition, role of physical exercise, role of good sleep, not just for the mental well-being, but also the immunity and body's ability to cope with stress of any kind. So, having said that, I mean, it's bringing, I think it's raising children who are more equipped, who have seen death, danger, and just uncertainty and unpredictability from very close. And the more they are supported by parents, I always advise parents that even if you have had a death in the family or some people are going through a positive, the diagnosis has been there, as through any crisis, you have to provide a structure to the child. I have seen parents who have become so lax that my poor child is not going to meet the friend, so be lax and give them as much Netflix time as they want to do. And I always talk about have a reasonable structure. Even if they are being homeschooled, have a reasonable time when they're waking up. I mean, being at home and doing things at your own pace don't mean that they're waking afternoon, because that's just going to turn their sleep cycle, sleep hygiene upside down. Make sure that you're having proper meal times, proper snack times. You're focused on less of starchy food, less sugar food, more natural whole grain stuff, dry fruits, poultry, milk. You're watching what you're eating in a very balanced way. And even at home, with all the restrictions, we can still figure out some way of getting some physical exercise at home. Social connections. I mean, kids are in that text generations and emoticons, but I always encourage them that have at least 1 to 2, 3 close friends where you're talking to them on FaceTime. It's always a different thing to talk somebody on FaceTime, get on the cues. Parents are often concerned like how well adjusted my child would be with social skills and interpersonal relationships. So of course we have that privilege that we are in this, we can Zoom talk, we can have conversations like this. So that face-to-face conversation talk through the phone, that's important. Another thing that I stress with parents is, they are the anchors, and how well adjusted they are, how much of anxiety and tension and stress they are bringing, and how they are coping with it, it's going to impact their child. Like I have had one kid who said, my dad, he's on Zoom meetings all day, and then he says, okay, I'm going to have a glass of wine. Everybody just be away. He's not coming to the dinner table. He's not dining in with the family. So here it's a family of 4. Everybody on screen. So why worry about social interaction when you don't have that cohesiveness in your own house? So it starts from very basics and back to common sense. These are the things that makes important relationships and helps us value important relationships in our life. We hold on to that. And then I tell parents, like, despite structure, we are humans. We are not like robots. And we are going through stress at work. We are dealing with grief and loss related to family members, friends. We are vulnerable. Let the child see it. But then your role becomes that after sobbing, crying, you're still able to get yourself together and show them that this is how we deal with stress and keep moving on. So parents are the real anchors and role models there. Structure is important with some reasonable flexibility. Everything cannot be like timed and like this is this time. But what if the child just heard that the friend has lost a father? So there, if your child is not in that state that this is the time for me to be in my classes, but I'm not able to focus, there you have to be there to let your child vent. Be a listener, talk to them, support them. Don't give them any false hopes, but give them that message that this is what it is. These are the things in place that we will together make it through. So, yeah.
Yeah, so you mentioned about this being a landmark year in a way, and a big event of colossal magnitude. It's impacting the whole world, everybody's life. So can actually become a kind of watershed year for all of us. Do you think it makes sense for the parents to actually sit with kids and talk to them at a different plane, at a different level, and give them a new perspective to look at this thing in a different way? Will that help them in future?
I think so. And even in my personal, my relationship with kids, like I said, kids have a very short sense of, they are not that futuristic. And I see many of the kids, they cannot look beyond that there is a hope. That's what we have to impart them. There is a hope and things would be back to normal. This is what we will be doing. And sometimes it feels like it's a period and it's a full stop, but life keeps moving on. I remember recently I had a conversation with my daughter about 1984 riots. I mean, I was part of it. I survived, did well in school and my family is fine. There were losses, but life moves on. So I think kids, based on their intellectual level and the level of functioning that they are at, it really depends, that intuitive sense and the temperament of the parent and the child both, where you can gauge where you are, what is the anxiety that you are stuck in, letting them vent, letting them talk about it. And then, it's great, the storylines and the true stories of survival and how people have been more resilient through different crises in the past. We had discussion about Spanish flu with my 11-year-old. So again, things have happened in history. Does not mean that we are at that apocalypse and the world is coming to end. We just have to focus in here and now, be there to support each other and move forward. So I think
the message for the parents is that be the anchor for the child, give them a new perspective, maybe a historical perspective, to tell them that yes, in the history these things happen. This time will pass, and we'll come out of it stronger. Verma, what is your message for the parents and for the children? That what is the way forward? How to prevent, say, the third wave or the future catastrophe, or getting the kids affected very, very badly? Of course, this time will pass, but they should not leave behind a big devastation in its trail.
So, honestly, Sanjay, you have to change the way you think. You have to convert the adversity into something which is nice, right? You have to look at the bright side and you have to lead from the front. So we have to stop making excuses. Let's take a simple example. You have a phone call, oh, Dr. Verma, bad time, so please give me some medicine for immunity from my child. I said, immunity? No, but my friend's child is having multivitamin with zinc and vitamin C. I said, when you were small or when I was small, I never took a multivitamin or iron. It all came from food and it must come from eating a balanced diet. So the key is to do things on time, right? So if you eat on time, what was dinner? Dinner was a balanced meal which the mother cooked, which the family sat and ate together. Now that's crucial. What Manpreet was saying that, I finished I'll say, no, it's time. I want to have a glass of wine. You guys go on. No. If you lead by example and if you get everybody, either I can say, oh, what a terrible time. I can't meet my friends. I can't travel. Or I can say, I have 1 year that I have spent with my family. I sit and talk to my children. I play games with them. We sit and play cards together. We play board games together. We cook. We take turns. I mean, it must have been after God knows how many years. I said, okay, let me try. I cooked a dish which came out wonderful. So it's a question of bonding together. Sleep is an extremely important part. Okay, so if you have to teach children time management. So I'm not going to tell you that you can watch. This is the amount of time that you have for the screen. You do it by yourself. If you're over on Tuesday, you're over on Tuesday. Then you stay without it. Let them make their own choices and try and gain. And I can't expect a 6-year-old child or a 10-year-old child or an 11-year-old child to understand or comprehend what is happening. We have to be their support. So we have to treat this as an opportunity. And I think one very, very important message for us to learn is that if we haven't learned from the first wave, we've learned from the second wave. Country after country has been devastated. I have a lot of friends and batchmates who live in America. My son lives and works there, and they had a bad time. We know what happened when they had cases in New York and their medical system were overwhelmed. Nobody is prepared for the kind of things that happen. So we need to prepare. We need to prepare ourselves, and we need to prepare in multiple fields. But how can I prepare? I can prepare by preparing myself mentally and physically of how to cope with this. So if I can't go and play a game, nothing stops me from walking in the house or walking my dog or doing some kind of exercise. Nothing stops me from controlling what I eat. So the battle is in our mind, and we have to lead by example. So if parents lead by example, you may not always succeed, but you have to learn to talk. You have to talk. Gone are the days when you tell your child, this is it, end of story. I have said no. You need to talk, you need to explain, and you need to explain to the child what needs to be done. If you're on your phone all the time and you tell your child, no, 10 minutes, your time is up. So you have to explain what is there. And if you can bring in discipline in the way that you live your life, if you can have more or less fixed times when you eat, when you play, when you sleep, and you can put in a routine into your life, then that is one way out of the mess that we are in. We don't know how long it's going to last. We don't know whether there'll be a third wave or a fourth wave. It's speculation. How bad is it? But we do know, and I, at the sense of repeating myself, we do see that children are being impacted much more with each succeeding wave or each succeeding mutation that the virus is making. Children are also more vulnerable. There is also limited healthcare available for children. So if we want to be safe, we want to be safe ourselves, and we want to keep our children safe, then we need to have safe practices. I think that's singly the most important message for everybody. Follow good eating habits. Be in touch with your doctor in case there is any symptom. If there is a vaccine which is there, which is available, please take it. Please take your other vaccines as well. We don't want a flood of vaccine preventable diseases. So if you are careful, there is light at the end of the tunnel.
That's fantastic. So I would just sum it up by saying a few words that most important thing to know at this point of time is that this particular strain and this particular wave is impacting children in a big way. To prevent any future harm to the kids, it's time to act now. To prevent things from going out of control now. So we have to be aware that kids are getting affected, kids are getting impacted in more ways than we can imagine. So we need to take care of all that. We need to act now to prevent any future harm to the kids. So with that, I'd like to thank my guest, Dr. Verma. Thank you very much for taking time out for this show. Dr. Manpreet, thank you very much for taking time out of this show. It was really amazing talking to both of you. And I'll take leave of all of you. And I'll see you again next Friday, same time on Dr. Dhawan's live chat on IBM TV. Thank you very much. Namaste. Stay healthy, stay safe. Keep keep everybody else around you safe and healthy. Bye-bye.
Thank you.
I welcome all of you to IBM TV and to this show, which is Dr. Dhawan's live chat, and I'm your host, Dr. Sanjay Dhawan. I'm an eye surgeon practicing in New Delhi. The live chat is a show which talks about any and all aspects of life, any subject, anything that concerns the life or it improves its quality is what we will be talking about. How to plan for it, how to prepare for it. So we'll be talking about all of this. Looking forward to seeing all of you every Friday night, 9:30 p.m. to 10:30 p.m. Indian time. Thank you. Bye-bye. Namaste.